Hi, this is Dr. Ray Soletic at Manhasset Otolaryngology here in Manhasset, New York. And I want to talk to you for a moment about using Botox for aesthetic facial care. Botox is one of our safest medications. Botox has been available for over 30 years. And when people ask about the safety of it in facial cosmetic care, if you compare it to Tylenol, it's incredibly safe. Last year, approximately 3,000 people died in America from Tylenol use. 0 people died from the use of Botox. So it's an incredibly safe medicine to use for facial cosmetic care. My goal in using Botox for aesthetic care in the face is to have it appear as a natural, comfortable presentation. And the way that I achieve that is by using a dilution of the Botox solution that allows better dispersion in the face and often requires a little less of it to achieve a very desirable result. For our imaginary patient here this morning, the essential components to making this a very comfortable experience with an excellent outcome involves using the tiniest number 34 gauge needle. And I know you can't see the needle tip here, but infrequently do we ever need facial anesthetic with such a tiny needle. Many other people use larger needles, 30 gauge, sometimes even bigger, and these almost always require some type of a topical anesthetic, but the 34 gauge needle rarely does. The other component of achieving this well is using calipers to accurately measure the distance between important landmarks of the face by using little Crayola marking dots, which come off easily with just a little alcohol pad, and using a medical grade caliper to measure the essential relationships in the face so that when people talk about having had Botox and saying, gee, my eyebrow drooped a little bit, it's because more than likely the person that did this treatment did not use a caliper to precisely measure these important distances to avoid that particular outcome. The other part of doing this, for me, in the next step at the application of our Botox treatment, involves using the Zeiss magnifying eye loops so that in our imaginary patient here I can precisely deliver the amount of Botox and at exactly the depth that I want it to be beneath the skin so that I avoid piercing the muscle to permit an improved distribution with a smaller amount of Botox to give my patients that natural effect that is what we work so hard to try to achieve. So these are a few of my personal approaches and philosophies with facial cosmetic Botox use, and I hope this has been informative to anyone watching this video. Thank you. Dr. Ray Soletic at Manhasset Otolaryngology in Manhasset, New York.